Ever walked out of the ER thinking you survived the worst, only to get home and see a bill that makes your heart race faster than the trip that sent you there? If you've ever wondered why healthcare in the US costs an arm and a leg, sometimes literally, stick around. Today, we're peeling back the curtain on the shocking factors driving up hospital bills, and trust me, it's more than just the medicine. Uncompensated care. First up, did you know that hospitals have to treat everyone even if they can't pay a dime? Ever wonder who covers that cost? Well, it's the law and a critical part of our healthcare safety net. But when uninsured or underinsured patients can pay, hospitals are stuck with the cost. In 2020, US hospitals provided over $42 billion in uncompensated care. Over $42 billion in uncompensated care. Just think about that for a second. To offset these losses, hospitals spread the cost across all their services. That means paying patients, especially those in emergency care, often face higher bills. The complex billing system. Hospital bills are like restaurant bills, except if you didn't get to see the menu, and each item has a hidden price tag. Every single aspirin, blood test, or doctor visit gets assigned a different price. And here's the kicker. It's all coded in a language no one understands. Hospitals need teams of billing specialists to navigate tens of thousands of these codes, which are used to bill insurance companies. Mistakes, delays, and reprocessing claims all increase the administrative burden, adding more costs to your bill. Hospital bills are like puzzles with thousands of pieces, but without the picture on the box. It's no wonder most people feel lost trying to figure them out. Lack of price transparency. One of the most frustrating parts of hospital billing is the lack of transparency. You often don't know what anything costs until after you've received care. And the same treatment can cost wildly different amounts depending on your insurance and the hospital. This lack of upfront pricing leaves patients blindsided by massive bills and contributes to the overall rising cost of healthcare. Imagine buying groceries and not knowing the price until you check out. That's hospital billing in a nutshell. Defensive medicine. Doctors often order extra tests to cover themselves from lawsuits, leading to higher bills. It's called defensive medicine.
Look, I became a doctor because I wanted to help people, but orientation yesterday, it didn't really focus on patient care.
The hospital doesn't want to be sued. Being sued is not a good thing.
Ever felt like you had a test that wasn't really necessary? It might be because of this. While it's meant to cover legal bases, it leads to unnecessary expenses. Defensive medicine alone accounts for a good chunk of all healthcare spending in the United States. High staffing costs. Imagine going to the ER at 2 a.m. Doctors, nurses, even janitors are all working nonstop. But keeping a hospital running 24/7 doesn't come cheap. These labor costs make up nearly 60% of hospital expenses. And with a growing shortage of healthcare workers, hospitals are paying even more, sometimes hiring expensive temporary staff like traveling nurses. During the COVID pandemic, some nurses were earning over $5,000 a week. These staffing costs directly impact the prices we see on our hospital bills. Advanced medical technology. Modern hospitals rely on cutting-edge technology. Think MRI machines, CT scanners, and robotic surgery tools. These machines can cost millions of dollars, and that's just the start. There's also installation, maintenance, and training costs. For example, an MRI machine can cost up to $3 million, and just one scan can set you back thousands. That $1 million MRI machine I mentioned? Even if you don't need one during your stay, you're still paying for its upkeep. Overhead and facility costs. Running a hospital is expensive, and I'm not just talking about the cost of all those beeping machines. Think about it. Keeping the lights on in a place that never sleeps probably costs as much as running an airport, except no one's waiting in line to board a plane. They're massive facilities that never close, with huge overhead costs like utilities, security, and janitorial services. Plus, hospitals need large administrative teams to handle billing, HR, and other operations. All of these costs get passed along to patients. Medical supplies and medications. Hospitals go through an immense amount of medical supplies. Gloves, syringes, bandages, you name it. Many of these items are single-use, so they have to constantly restock. Ever wonder why a bandage costs $50 at the hospital? Must be made of unicorn hair or something. And then there's the cost of medications, which can be staggering. Some life-saving drugs, like those used for heart attacks or strokes, can cost thousands of dollars per dose. All of this adds up to more expensive care for patients. Length of stay. The longer you stay in the hospital, the higher the cost. A hospital stay can easily cost between $2,000 to $5,000 per day, and every extra day adds more expenses, whether it's for meals, medication, or routine checks. Even short hospital stays can add up quickly. Staying in the hospital for a few days, it's like booking a hotel room, except this one charges you for every bed sheet, pillow fluff, and glass of water, and there's no minibar. Non-emergency ER visits. Many people use the ER for non-emergencies like colds or minor infections. Since ER care is built for serious life-threatening conditions, these visits end up costing far more than if patients went to a primary care doctor or urgent care. This also strains hospital resources and drives up costs for everyone. It's frustrating, right? You're stuck with a massive bill for a minor issue because the ER treats every case like it's life or death, because sometimes it is. The profit motive. Most hospitals operate as businesses, even nonprofits. They need to generate revenue to stay afloat, and that often means higher prices for everything from emergency room visits to surgeries. Hospitals invest heavily in expansion and advanced technology to attract more patients, but this also pushes up costs, and with hospital executive salaries sometimes tied to financial performance, the focus on revenue can leave patients paying more. When hospitals are run like businesses, it's like if Starbucks charged you $100 for your coffee because, hey, someone's got to pay for that new espresso machine. Insurance negotiations. Finally, there is the negotiation process between hospitals and insurance companies. Two people walk into the same hospital, get the same treatment, but end up with bills that look totally different. Why? Well, because behind the scenes, hospitals and insurance companies are constantly negotiating prices, almost like haggling for a car. These private negotiations determine how much each service costs, and they vary widely depending on the hospital and the insurance provider. So the next time you're staring at a hospital bill, remember, it's not just about what you paid for that visit. It's about staffing, technology, and a healthcare system that's more complex than most of us realize. One thing you can do is always ask for an itemized bill and question any charges that don't make sense. Hospitals can sometimes correct mistakes, and you could save yourself hundreds, maybe even thousands. And while we wait for change, sharing stories and understanding the why is the first step. If you've been hit with a surprise bill, tell us your story in the comments, and remember, don't just accept that bill. Ask questions, demand explanations, and keep fighting for transparency. If you want to see more videos like this, breaking down complex issues that hit your wallet hard, hit subscribe. Let's make sense of this mess together.